This taping technique is one of McConnell taping techniques, and it's the diamond technique, which is a great technique to use for people who have just quite severe anterior knee pain, or even in your elderly patients who maybe present with osteoarthritic changes of the patello-femoral joint. Firstly, we want to just sort of roughly outline the patella and the position of the patella. So we want to make sure we get, first of all, the sort of proximal corners of the patella, and then the inferior pole of the patella. So there we have the position of the patella. And the other thing we need to know with the diamond technique is the positioning of the fat pads, which is just roughly there and there, because we don't want to irritate the fat pads. They're very, very pain sensitive structures. So you're going to be using the Hypafix, which is the 5 centimeter hypoallergenic tape. It's a very nice tape to use. It's very porous, and it just allows the skin to breathe. With this taping technique, you can actually leave and tell the patient to leave it on for 48 hours. They can bath and shower with it, and it shouldn't come off. So basically what we're doing is positioning a diamond shape, and you can see that we're just hugging the fat pads there. We're not, nipping them, we're not moving in too close over the patella, we're literally just hugging them there. So these are your sort of inferior strips. And your superior strips, we don't want to compress the patella in any way, we're trying to get the sort of lift off, so we want to make sure that we are just outside of these little corners of the patella. And you also want to ensure that roughly the crossover point is central in line with the patella. And again, you want to make sure we're just outside of the patella there. Okay, so there we have our foundation. And then we're going to fix the Leukotape on top of the tape. And once you've positioned the Hypafix correctly, it's very easy. You know exactly where you need to be with the Leukotape. So we're going to cut little strips. We'll measure them first. Very important not to get the Leukotape in touch with the skin. It very quickly deteriorates the skin, particularly the inside of the knee is very, very sensitive to the Leukotape. So we're just going to adhere it and just lay it down. I'm not putting any tension on it yet. And we're measuring the next one. And now we're going to start putting the tension on. I've just adhered a little strip of Hypafix here just to make sure that this taping stays in place, and I've also just drawn some arrows just to show you the direction of the pull of the tape. And what we're going to do is just loosen that first strip that we've put down. You're going to position one thumb on the base of the tape so you're not going to pull it off. I mean, I have small hands, and you need to really just stretch them far to grab the bottom edge there, to pull these two poles together, put some tension on the tape and stick it down. Now remember, you don't want any of the brown tape on the skin, so make sure that you just cut that final little edge off. And you can see that it's gone all wrinkly, which is exactly the effect that we want. And then going to do the outside strip, we're just going to pull it loose to the base. Again, you're going to just position one thumb on the base, one thumb at where we need to be. You're going to put some tension on the tape and we're going to stick it down. Again, we're getting that nice creased effect, and any excess tape that would get in touch with the skin, you make sure you remove. The next bit is going to be the inferior lift. So we're going to again just measure the two Leukotapes. And just rest them loosely on there. Just measure that Just going to put a small strip of Hypafix. And just to keep this bottom corner from pulling off, because you're going to have two tapes pulling on the same point, so it will easily pull loose if you don't reinforce it, and particularly if you're dealing with very hairy legs. You may actually need to ask the patient just to remove some of the hair for the next session that they come in. So we're now going to put tension on these strips to try and offload that fat pad and to create a lift of the patella. So again, one thumb on the base, one thumb where we need to, or the other finger where we need to be. Make sure to put tension on the tape as well, and just literally squash everything together. Take the excess bits off. And then we're just going to do the same with this one. So really what we've done now is we've offloaded the patella, and most patients have quite good pain relief with this technique. If one of your comparable signs is a single leg squat, you could just retest that, and most patients will report about a 50% immediate pain relief with this particular technique. It is quite extensive, but it's really great relief for the patient, and then they can soon start their rehabilitation.